everybody now. And we're going to make a start. So on behalf of the Community Planning Alliance, I'm sorry, I'm going to be interrupted in a second. Just hold on a minute. That's a great start. Okay, I think we can start now. Okay, so on behalf of the Community Planning Alliance, I'd like to take the opportunity to welcome you all to the webinar this afternoon, and certainly fantastic to see so many of you on the call. This is the first of 3 planned events aimed at engaging communities more actively in the air pollution or air quality debate. So it's really fabulous to see you all here. And from what I've read, this is something the government wants to encourage. So we want to take you all on a non-polluting journey with us to exploit the current opportunity to take action to reduce the harmful contaminants in our air. And this first session is going to focus on the government's plan to introduce more rigorous targets for air pollution and why that's so important. And we'll say a little bit more about the other sessions as we're planning when we get to the close of this one. I won't say any more about them now. You'll all be aware that the Government's Environment Act became law on the 9th of November. And whilst the Act may not include everything everyone wanted, it does promote tackling air quality, in addition to a number of other environmental improvements, and it brings scrutiny and commitment to key elements of the 25-year environment plan. So let's celebrate it for what it is and seek ways to improve it. The government sees this as a transformational legislation, with a key headline being a target on ambient PM2.5 concentrations and a requirement for local authorities to tackle the sources of air pollution. That's all great news. And in some ways, sadly, the air quality elements of the bill were a bit overshadowed in the final days by the discussions about sewage and water quality. Also important things, but nevertheless proposals were made by the House of Lords, although sadly they weren't supported in the Commons despite the proximity of COP26 at the time of the debate. And our discussions today can consider how ambitious targets can be introduced. So we'll be talking about the possibilities and challenges of the complex debate to date, not least because the World Health Organization has recently updated its guidance. And we all recognise air pollution is a threat to the health of both humans and wildlife, and plants actually. And we know action is needed to introduce policies and measures that will reduce the harmful effects we're facing every day. The burden on the NHS, our economy and nature's recovery is very visible. So we're looking forward to discussing with you the opportunities we have to move forward from today's baseline. I'm sure our speakers are going to talk about a number of statistics as part of their sessions. I just want to mention one now. According to the World Health Organization, every day around 93% of the world's children breathe in air that is so polluted it puts their health and development at serious risk, which is appalling. Progress is being made though. On the 17th of November this year, the UN acknowledged children's right to clean air, and a group called Global Action Plan is fighting to get the right to clean air recognised as part of the UN's Convention on the Rights of the Child. But what can we do in the meantime? In addition to hearing from our speakers today, we'd like you to share your thoughts with us. So just before I introduce our eminent speakers, a little bit of admin. I want to confirm that we are recording the call today. So please turn off your cameras unless you're a speaker or unless later in the debate you are talking. So can everybody turn off your cameras? Can you put your microphones on mute? We'd like you to put any questions you have in the chat. We'll be monitoring that throughout the session today. And hopefully we'll have a bit of time for dialogue at the end. And we'll bring some of your questions, we'll put some of your questions to the speakers. But we won't have time to introduce participants individually because we have so many people on the call, which is fantastic. So what we'd like you to do instead is to put in the chat, and if you don't know where the chat is, it's a little speech bubble with a few lines on it. If you hover over it, it probably says something like show conversation. If you click on that, you can see what other people have been saying about where they are, who they are, where they're from, and why they're interested in the air pollution debate. So if you can do that too, it'd be great to hear from you. Now, we've got a very stimulating session planned for you today. So I'm delighted to welcome our three renowned speakers who are going to help us unravel some of these major issues, identify prospective solutions, and understand the potential next steps for this very complex topic. We're very lucky to have Andrew Jackson, head of the joint Defra DFT Air Quality Task Force, talking to us today. I think you could wave, Andrew, although I'm sure they'll know which is you. Andrew has been head of the Joint Air Quality Unit since 2017. His team is responsible for the delivery of the 2017 Air Quality Plan for nitrogen dioxide, and they have worked with a range of local authorities to deliver a number of air quality projects, including the clean air zones. And Andrew, I don't know if you want to start sharing your slides since you're first up. While I just introduce our other two speakers. We're also very fortunate to have Professor Roy Harrison with us today. Do you want to just give us a wave, Roy? Thank you very much. Professor Harrison has served as an advisor on a range of government committees for many years. He's supported the development of policy. He's an expert in the field of air pollution, from emissions through atmospheric chemical and physical transformations to exposure and effects on human health. So that's a bit of a mouthful. So he's very much providing the glue that brings together today's three presentations. And our final speaker is a Queen's nurse, Heather Henry. Her other nursing awards are too numerous to mention. She's also the founder of an innovative organisation called Breathchamps. Heather is passionate about improving the health of asthma and respiratory disease sufferers. And as a consequence, she's got a huge interest in the improvement of air quality. She works with local people and professionals to design successful solutions that help children, families and communities to learn and share asthma knowledge in fun ways. And we're going to find out a little bit more about that later in the session. Now, with no further ado, as I said earlier, the Environment Act has passed the approval stage, so the real work begins. We'll hear about it a little bit more from Andrew. Thank you, Andrew.
Thank you, Marge. Thank you for the introduction, and I'm really pleased to be here, and it's great to see such a broad range of participants at this event. So I hope that we can fulfil the billing that you have given us. So as Marge has said, my name is Andrew Jackson. I am the head of the Joint Air Quality Unit, which is a Defra and DFT unit that is responsible for delivering the nitrogen dioxide plan that was published in 2017, that is tackling NO2 exceedances in towns and cities across England. I also actually have responsibility in Defra for noise and statutory nuisance, so a number of the issues that will also be very, very closely related to air quality. People have already mentioned in the chat bonfires and things like that. So I have that sort of broad perspective, and I work closely with colleagues both in local authorities but in central government on tackling air quality and improving sort of transport infrastructure. My intention is to give an overview of the national perspective, but obviously in the Q&A and in discussions, happy to sort of dive into the details as we go and as people see fit. It's a quick bit of background from government's perspective. I think it is worth saying, of course, that air quality has improved significantly over the last years. PM emissions, nitrogen oxide emissions have all fallen to very low levels compared to where they were and compared to when since records began. And that's been a collective effort across a range of sectors in the UK. That has been due to, the effort of local campaigners, to national campaigns, industry, all sectors, local authorities, etc. But I think we are absolutely clear that there is more to be done. Air pollution remains the biggest environmental risk to human health in the UK, and there's absolutely no room for complacency. I think, we are clear that there is no safe level of air pollution. And that's why across the UK we are taking action to curb the impact of air pollution on citizens and communities. So we've published the Clean Air Strategy in 2019 that sets out how we'll meet international commitments to reduce the impact of the harm caused by 5 key pollutants. But alongside the Clean Air Strategy, we have things such as Transport Decarbonisation Plan that is sets out how the government plans to transition to zero emission road transport and to reduce emissions globally from transport. You've also got net zero initiatives coming from BEIS. You've got industrial emission strategies coming from there as well. And alongside that, sits the very targeted delivery programme that I'm responsible for, which is tackling roadside nitrogen dioxide concentrations. You have mentioned already the Environment Act, and we know that there is a strong case for taking ambitious action on particulate matter as the pollutant that has the greatest impact on health. So the Environment Act passed this year establishes a duty on government to set 2 new legally binding targets for air quality. 1, a concentration target, and 2, a long-term target that will focus on population exposure reduction. So whilst the concentration target will act as a minimum standard across the country and is analogous to the target, will be analogous to the targets that we are already focused on in nitrogen dioxide, and that will focus action to reduce PM where concentrations are highest. The idea behind a population exposure reduction target is to maximise public health benefits across the board and to reduce exposure to everybody, not just targeting action in the areas that are worst affected. And this will obviously build on our investments in terms of cleaning up transport and tackling NO2 pollution. It will also make it easier for local authorities to address sources of air pollution in their areas and includes other powers for government, etc., to mandate the recalls of vehicles where they do not meet legal emission standards. There is a lot of ambition within the Act. Yeah, in terms of implementing it, that's where it becomes, really challenging. So we've set a level of ambition, but we are now having to conduct the essential and detailed work to develop the targets in detail, to set the level of ambition and include focus on, how and where to monitor pollutants and how, of course, to measure progress against those targets. And these are steps that the WHO recommends that we take before we set targets, including having fully costed analyses. And I think as part of the debate, as the debate went through Parliament, I think a number of experts said that there is obviously much more to setting a target than simply crossing out a number and writing 10 or whatever that will be. I think at this stage, the full mix of policies and measures that would be required to meet any PM targets are not yet fully understood, but the scale of challenge may be quite significant. If we look at London and other cities, to meet a target equivalent to the WHO's 10 micrograms target would require policies such as a total ban on solid fuel burning in cities, alongside a significant reduction of traffic kilometres across our cities, perhaps 30, 40, 50%. And additional measures would need to be considered around construction and other highly localised sources of pollutant. So I think it's important that we base target setting upon evidence, and we need to know the impact of choices that we need to make to achieve those. And I think some of the challenges, and I've just seen the comments in the chat that we'd be okay with the ban on solid fuel burning, I think we have to acknowledge that there remain households and individuals who are reliant on solid fuel burning for heating. Whether that's appropriate in a city centre or in a town, or whether that's a rural issue, is something that we will no doubt need to debate as we go through the process. So we'll be launching a public consultation in early 2022 on the proposed targets for reduction in PM. The intention there is to ensure that everybody's views inform the action we take to improve air quality, that we can build on events like this to have the debate. And I think, you know, as a government, we are committed to ensure that there is no community is left behind, and it's vital that we tackle air pollution. And as we do so, we focus on communities disproportionately affected by poor air quality. So I've already talked about the need to be pragmatic, to tackle air pollution in a way that still enables people to travel, to heat their homes, to live their lives in a way that's sensible and fair, but focused on limiting damage to the environment and to people's health, and to looking to meet increasingly ambitious targets. So I think, you know, our intent as we go through this is about ensuring that choice remains, but that we are looking at how we can drive more travel options, more affordable clean heating options, etc., etc. And that will be across government and across society debate. So the consultation will launch early next year. There will be all sorts of evidence being submitted to that, and our intention is that we will be looking towards the back end of October 2022 to lay air quality targets in secondary legislation. I think, you know, the interesting thing to note around the complexities of this challenge is that if we reflect on 2020 and our experience in 2020 was that during lockdown, we saw a significant reduction in road traffic. That's led to an almost similar and instantaneous reduction in NO2 levels across the country. What we didn't see at the same time was a similar reduction in PM. So, you know, there is not the same clear correlation, for instance, between transport and between PM. Things like the weather played a big impact. There are annual cyclical events such as spikes in spring when there's quite significant amounts of farming on the continent. So, you know, there are multiple factors that we'll be looking to consider when we're setting those air quality targets. I wanted to also, as well as just setting out that sort of background on targets and some of the challenges that we are looking at in the process to set targets, I wanted to quickly canter through the work that we have already been doing under the nitrogen dioxide programme. You know, I've already said pollution is the biggest environmental threat to health. Our most immediate air quality challenge is nitrogen dioxide concentrations around roads, which is a air quality limit that the UK currently fails to meet in a number of areas. And there is, of course, evidence that there's a strong association between exposure to NO2 and a wide range of adverse health effects, including asthma in children and chronic mortality, which I'm sure other speakers will come on to. Of course, if you reduce NO2, you'll get associated benefits by reducing particulate matter. NO2 in some ways is potentially a simpler challenge to grapple with. The infographic on the slide shows that the vast majority of NO2 is produced by traffic, and then from within that, the vast majority of NO2 is produced by diesel vehicles. So the government has a programme investing £880 million to clean up transport and to cut pollution in the shortest possible time. We're working with over 60 local authorities to put in place plans to tackle these emissions, and we're supporting local authorities with funding and expertise to help them develop plans and measures to support those affected. But what we firmly believe is that this isn't a top-down approach. It has to be delivered through local interventions, local knowledge, and local plans to tackle those challenges. Now, we work with the authorities to come up with a range of interventions. Our preference is non-charging measures, but we are working with several local authorities to implement charging clean air zones, where the most polluting vehicles are charged to enter into town and city centres. Before I talk quickly about CASs, there's a whole variety of more targeted non-charging measures that we have worked with local authorities to implement. So the likes of Derby and Coventry have implemented traffic management and rerouting systems, often dispersing the traffic has a very, very significant impact on NO2 levels, reducing hotspots, easing congestion, and creating a more pleasant environment for everybody. But alongside that, we've funded junction improvements and cycle schemes. Leicester, for instance, has benefited from a number of local cycle schemes that have encouraged people to move away from cars towards cycling, through cycling proficiency schemes and the like, and also making people feel safer when cycling, because obviously as part of our broader initiatives to encourage active travel, and as a cyclist myself, it is critical to see that type of safety infrastructure and to create a more welcoming environment for people to adopt different forms of transport. There's some technical measures that we have also funded. So we've provided over £80 million in retrofitting buses. That basically puts in, removes tailpipe emissions of NO2 from older buses, replaces some of the technology in the buses and cleans them up, reducing NO2 by over 90% in successful conversions. And that is a very cost-effective measure, 16,000 per bus compared to over £100,000 for a brand new low emission or zero emission bus. That funding has been made available to a variety of local authorities. I was talking to MPs from Stoke this morning about the impact of bus retrofit in the city centre, in the town centre of Stoke, but we've seen that rolled out across a number of local authorities across England, and over 4,000 buses have been retrofitted. We are, and perhaps the sort of flagship intervention that we are responsible for, are clean air zones. These are areas where targeted action is taken to improve air quality and focusing, charging the most polluting vehicles for entering into certain areas within towns and cities. We have a broad framework. Our intention is that interventions are appropriate, so we don't want all local authorities to consider charging all vehicles to enter into their town centres, but where it is appropriate, we look at focused action targeting the most polluting vehicles. So some local authorities are implementing charging clean air zones that focus on charging taxis, buses and HGVs. Others are extending that through to light goods vehicles and private cars. But in terms of enabling local authorities to do that, I've already mentioned significant amounts of funding that is available, both for the infrastructure that is necessary to deliver a charging clean air zone and the interventions that I've mentioned, like bus retrofit, but also looking at what we can do to support individuals and businesses affected by those measures, because we recognise that this transition isn't always without pain. We are asking people to make significant changes to lifestyle and to modes of transport, and people cannot always afford to make that transition. So we have a clean air fund to support individuals and businesses affected by measures, and a wide range of options that local authorities can consider. So, things such as park and ride services, freight consolidation, travel schemes and improvements to bus fleets have been set out. So that's a quick oh, sorry, there's one more slide. So where have we launched? We have launched in Bath and Birmingham, and also in Portsmouth in the last couple of weeks. We're working with Greater Manchester and Bradford, who are in the process of going live, and we are now starting to work with Bristol, Tyneside and Sheffield to deliver CASs. So I appreciate that that's quite a quick canter through. What I try to do is set the tone in terms of what government is doing, what the Environment Act is intending to do, some of the complexities of setting numerical targets, but don't underestimate government's ambition in this space, and a little bit of a practical canter through where we have already taken some successful action to deliver targeted interventions to reduce NO2 pollution in particular local authorities. As ever, we're keen to hear feedback. Any questions, obviously put those in the chat, and I'm available after this session as well. I will stop presenting and either hand over to Marge or Roy, who may be next.
Yeah, Roy. Well, just while Roy is getting himself set up to present, what I should have said at the beginning was that we are going to just take questions of clarification after each speaker, and then we'll have a discussion at the end. And from the questions that are coming through, wood burning and the clean air zones are certainly big topics, Andrew. But perhaps one question of clarification for you: the new WHO targets. Where do you stand with those in the Environment Bill? Are those the targets that will be considered, or?
I think it is fair to say that the new WHO targets are very ambitious, and indeed, you know, the lowest level target that they have set, they have also set a number of steps towards that in terms of guidelines that people may wish to consider when looking to achieve that. I think we have to set something that is ambitious but is realistic. Even at 10 micrograms, I think, you know, you would be seeing quite significant changes to how our economies work in comparison to, you know, even more ambitious targets. So I think, yeah, there's a debate to be had on that. I think we want to be as ambitious as is possible, but we also want to bring people with us and to make sure that we set targets that are realistic.
And is that something that will be the topic of your, or one of the topics of the consultation at all, or?
You know, the terms of the consultation have yet to be decided, but obviously, you know, people will respond to that knowing that there's the WHO guidelines out there.
Yeah. Super.
I mean, I have to say, sorry, Margie, the way I try and sort of think about these is, you know, we have got a very significant ambition on net zero, which is a long-term ambition. And some of the targets the WHO sets do feel slightly more in that space than in the space of the 40 micrograms immediate targets that we're trying to deliver against on the NO2 space.
Okay. Well, as I said at the beginning, you know, it's great that we've got a bit of focus on this. So let's sort of move forward from where we are. Lots of questions though coming through, and I'll give you a chance to have a look at those, Andrew, and we can pick up at the after the three speakers. I don't think there are any other questions of clarification, although somebody did ask if you were working with a particular council. Yes, Wiltshire Council. Somebody asked if you were working with Wiltshire.
So Marge, what I'll try and do is I'll look through the questions and either respond to them or yeah, provide a bit of clarification in the chat.
Super. Okay, that's great. So Roy, you are sharing your screen, but we're not seeing your slides at the moment.
Oh,
We're seeing your Word document. Do you want me to share the screen with your slides on my screen?
I can just have one more go at this, and if it doesn't succeed, it would be best if you showed the slides. And
you can look at the Word document then, because you won't be able to see them both.
Sorry, I don't need a Word document.
Right. Try again.
Are you seeing my screen now?
We see your slides now. Yeah, they just need to go into present mode.
Yes. Problem is, I've got a small screen thing. Oh, here.
Yeah, there it is at the bottom. Yeah, that one. You were on the right one. There. That's it. Click on that one. That's it.
I'm seeing full screen. Are you seeing that?
Yes, we are. We're seeing full screen now. Perfect.
Okay. Sorry about that.
Thank you, Robbie. We'll let you do yours now. Thank you.
Thank you very much, Marge. Well, just for the audience, Marge asked me to say something about the science underpinning some of this. I can see from some of the chat that some of you are extremely well informed on the science already, so my apologies if I'm talking at too low a level, but I don't think all of the audience will be up to a similar standard, so I hope this will be of interest. So the most important locally acting pollutants are what we would typically call the classical air pollutants, and I've listed them there on the left. And they're all important in relation to human health. Some of them also affect the biosphere. Particulate matter and nitrogen dioxide affect visibility, and ozone and particulate matter can damage durable materials, particularly things like rubber, which reacts with ozone. So they're all important to us. The recent trends in concentrations in Western Europe are either, in most cases, fast downward, and I'll comment on that in a moment, and several, though, are flat, and by flat I mean that they're not changing very rapidly, either upwards or downwards, which can be rather disappointing. And in the case of ozone, it's a rather mixed picture, and I'll elaborate on that in a moment. So the success stories are notably smoke and sulfur dioxide, which have decreased hugely. We still need to do more. We still have enough sulfur dioxide to make quite a lot of sulfate particles. So although the sulfur dioxide isn't likely to be harmful to human health, the reaction products of it in the atmosphere are. Catalytic converters on road vehicles have hugely reduced carbon monoxide and benzene emissions, and so we are in relatively good shape there. We could do better, but they have come down hugely. And of course, the problem of lead emissions from motor vehicles was solved by the simple expedient of not putting the lead into the petrol anymore, which was a rather obvious solution, which has proved highly successful, and we don't even have much lead from industry. And in fact, it's some of the legacy lead that got into the soils and things that's now tending to have a big influence on our concentrations, but they're very low, fortunately. So the notable failures are nitrogen dioxide, and there are really two reasons for that. One was the failure to reduce NOx emissions from diesels. And the other one was that after, well, from Euro 3 onwards, more of the NOx coming out the back was emitted in the form of what we call primary nitrogen dioxide. So nitrogen dioxide that's actually emitted from the vehicle rather than subsequently formed in the atmosphere. And that meant that at heavily trafficked sites, nitrogen dioxide didn't decrease, and in fact at some of them it even increased over the years. We are beginning to see, I think, some decreases now as a result of clean air zones and the fact that the latest Euro 6 diesel passenger cars are having to undergo real on-the-road driving emission tests, which are having a real effect on reducing the emissions. So we are beginning to see benefits there, but they're very recent. And overall, the trends have been very flat for a long time. Now, ozone, part of it comes from the stratosphere, where we depend very much on it for filtering out ultraviolet light, but some of it mixes downwards. But the concentration, say, over the North Atlantic have about doubled since pre-industrial times, and that's because of pollution emissions of organic compounds and oxides of nitrogen. And the sort of local abatement policies, particularly for volatile organic compounds in Europe, mean that we don't see such big peak concentrations in hot, sunny summer conditions as we used to. But the hemisphere background has continued to increase slowly. So we're not in terribly good shape with respect to ozone, and much more needs to be done to reduce the concentrations. We're not nearly as badly off as some places like Delhi and Beijing, which really do have very hazardous ozone concentrations. Now, particulate matter, you all know, is a very major focus, and PM 2.5 concentrations haven't fallen as much as one would have hoped. partly because there are sources of emissions that we haven't really taken much account of. We thought that wood burning was not a problem in the UK, but it is, for example. Cooking emissions are important. And also the particles that we call secondary particles that are formed in the air from atmospheric gases are important. And they won't come down much more until we reduce sulfur dioxide and oxides of nitrogen emissions further. And this is just a reminder, if you focus on the vehicles in the picture, they're pretty old looking vehicles. Well, this is a report from a committee that advised what was the Department of Environment, a committee that I chaired. And the report was called Diesel Vehicles and Urban Air Quality. And we expressed the view that the impact of diesel vehicles on urban air quality is a serious one, and that any increase in the proportion of diesel vehicles on our urban streets is to be viewed with considerable concern unless problems of particulate matter and nitrogen oxides emissions are effectively addressed. And that was published in 1993. And unfortunately, government got hooked on the idea that diesels were actually good for slightly lower CO2 emissions and therefore incentivized them through the taxation regime, and wholly ignored this problem of local air pollution, which fortunately is now being addressed, but it's taken a long time to get to grips with. So this illustrates the problem. Going from Euro 3 at the top, which were introduced in 2000, through to Euro 6 at the bottom, which started being sold in 2014. Petrol cars on the left, diesel on the right, and the light blue bubble in the center is the emissions limit that the vehicle has to meet in its test, and the dark blue is the actual emission. And we see that since Euro 5, the petrol car has pretty much met the emissions limit, whereas the diesel, the emissions limit kept coming down and down, so it's much smaller on the Euro 6 than on the 3, 4 and 5. But the emission didn't come down very much at all. So the cars were on real road driving, they were not meeting the limit that they were meeting during the test procedure. And that's the basis of the Dieselgate scandal and so on, that motor manufacturers were using devices, either legal or illegal, to engineer vehicles that would pass the test, but when you actually got them out on the road, they were emitting far too much oxides of nitrogen. That has been tackled more recently with a change to the regulations of Euro 6, so there are now real driving emission tests, and that has made a significant improvement, which was long overdue. Now, the other pollutant with major health impacts is PM2.5, which most likely dominates the adverse health impacts of air pollution in the UK. And there we see a map of loss of life expectancy, and that's averaged across the entire population. The UK is in relatively good shape compared to much of mainland Europe, with an average loss of life expectancy probably across when you population weight it across the population, it's somewhere around 5 or 6 months, but it's a very major public health impact, and it's not shared evenly. Some people will lose far less and some far more than that, 5 or 6 months. So where does that PM2.5 come from? Well, actually road traffic, which is the pinky colour over here in our measurements there from North Kensington, which is a site in central London away from major traffic. It's only about 8%. At roadside, it would probably be double that or so. So it's not a dominant source of PM2.5. And the biggest individual source, typically and in this data set, is this over here, which is ammonium nitrate. And when I showed Marge the slides originally, she said, where's that come from? Well, the nitrate comes from the oxides of nitrogen emissions, largely from traffic, and the ammonia is from agriculture. And there are some easy hits that could be had in controlling those ammonia emissions from agriculture, but unfortunately the regulatory regime has been very slow in actually dealing with that issue. So pretty much 50% of what we see is ammonium nitrate and ammonium sulfate. And the key to reducing that is reducing the oxides of nitrogen and sulfur dioxide emissions and the ammonia that reacts with their oxidation products to make these particles of ammonium salts. But do note there are other things like wood smoke and food cooking that come into this, which are important. So for road traffic, the exhaust emissions here from 2000 to projections that go up to 2030 on the right, the exhaust emissions have come down very nicely with the fitting of particle traps on diesels, such that at the current day, the exhaust emissions in the yellow are less than particles that come from road abrasion, brake wear, and tyre wear. And that trend will continue. And as traffic volumes increase, so the tyre wear, brake wear, and road abrasion will tend to continue to increase, whereas the exhaust emissions are very low. And as we go to battery electric vehicles, so those exhaust emissions will die out completely. But these are not what they're called. They're not zero emission vehicles because they still have the tyre wear, brake wear, and road abrasion emissions, although the brake wear is somewhat reduced by the fact that they have regenerative braking, which means that the friction brakes are used a lot less. So overall, there is a marginal improvement for electric vehicles, but it's not nearly as big as one would hope for. And then wood stoves are a major issue, and these bars in the top part of the graph show the emissions from different types of wood stoves in terms of mass of PM2.5 for the amount of energy generated from the combustion. And you compare them with a gas boiler or a new truck, even without a filter, and they're much, much dirtier. So we do have a major issue over wood smoke, particularly in rural areas, but it does extend into urban areas, and we saw it in that graph from London. So that's one of the things that still needs to be addressed in a more serious manner. So bringing that together as a few conclusions, the main current problems in the developed world lie with nitrogen dioxide, ozone, and particulate matter. Further abatement of NOx emissions is essential to reducing NO2 concentrations, but will also improve the situation with respect to nitrate particles and also the deposition of nitrogen into ecosystems, which is reducing biodiversity. Particulate matter emissions from engine exhaust are declining, but other sources such as non-exhaust particles and wood smoke may well be increasing. We don't actually have very good data to tell us. Secondary particles derived from oxidation of sulfur dioxide, oxide of nitrogen, and organic compounds are the largest contributors to PM2.5, so control of the precursor emissions remains a priority. And finally, thank you very much for your attention. And I will hand you back to Marge and stop presenting.
Thank you, Roy. And while you're just while Heather is just setting up her camera, we do have a couple of questions of clarification. So the first question came from Caroline Dibden. She's asking, is the ammonia in agriculture from fertilizer, crops, or livestock?
The largest part of it is from livestock, but release from fertilizers is also quite significant, but livestock the major part of it. So the way in which we handle livestock waste is the one of the ways of dealing with this problem, but also more efficient use of fertilizers would help.
Super. Yes, I think that is a key action. And then another question from Stuart asking about the North Kensington data, asking what was the timescale over which it was collected and at what time of the year?
Right, it's winter data collected over a period of about a month, so it's a snapshot, but it is reasonably representative of central London in winter from other measurements that we have.
Super. Okay, well, I think again we've got a number of questions about the wood stove burning. I think that's obviously going to be, and you raised some very interesting issues about that, Professor Harrison. So I think we come back to that at the end, because I think we've got quite a few questions for yourself and Andrew about that. And maybe it's something, an initiative that we can look at having a bit of a focus on, because clearly it is a big issue. But before we go any further, I'd like to ask Heather to start sharing her screen. Are you able to share, Heather?
Yeah, sure. Can you see that?
We can, yeah. Just need to go on. There you go. Thank you very much. Over to you.
Well, thank you very much for inviting me, and it's really interesting to hear the previous presentations. So my name's Heather Henry. I'm speaking to you both as a nurse entrepreneur with lifelong asthma and part of my right lung removed, and also as a clinician focused on population approach to respiratory health. I'm what's called a Queen's nurse, which doesn't mean that I'm on first name terms with Queen Elizabeth. It's part of the Queen's Nursing Institute, which was the organisation that originally trained district nurses, and they were given the title Queen's Nursing Institute by Queen Victoria. So I have the honorary title of Queen's Nurse, meaning that I show quality and leadership in community nursing, and we're quite often called upon to speak at national level on various subjects such as this. And my social enterprise, Breathchamps CIC, helps people to learn about breathing in fun ways, and we're aiming to make Sale, where the company is based, where I live, the first breath-friendly town in the UK. Here you can see me aged about 7. I guess you wouldn't see pictures like that these days, at my primary school sports day in Bolton. And at that time I had exercise-induced asthma and came last in every single race, which had a big effect on my confidence, really. And naturally enough, part of Breathchamps' work is about highlighting the issues around air quality and the effect on health, particularly respiratory health. Here in Sale, we have a large peat bog at risk, and we've got the M60 running right by us, so it's a very moot point. The pollutants that have changed since I struggled to breathe as a child, with things like coal fires and smogs, and parents who smoked 20 fags a day for 20 years. But the challenges remain, albeit with different pollutants. And while air quality is exceeding international targets and affect all of us, the disproportionate effect is amongst the most vulnerable: pregnant women, children, older people, those living with lung conditions like myself, and those on the lowest income. And this is, as many say, an environmental injustice that magnifies the negative effects of social disadvantage. So let's start with children as we go along the life cycle. Marge has already mentioned the Human Rights Act and the Convention on the Rights of the Child. And yet, as Andrew mentioned, and I can see that's in his sites, 1 in 3 children in the UK is breathing unsafe levels of air pollution. So we have to think about the youngest in our society. And as Sir Michael Marmot, who I consider to be the godfather of public health, concludes, we need to put most effort into giving children the best start in life, because of course prevention is better than cure. He talks about something called proportionate universalism, and what he means by that is that we need to invest most in the very earliest years of life, and then proportionately less along the life course. And we get the biggest bang for our buck in terms of addressing our attentions towards the needs of the youngest in our society. So a lot of work has been done by the Royal College of Physicians and the Royal College of Paediatrics and Child Health on some of these issues, and they summarise it thus. The effects of air pollution start in the womb, where pollutants travel from the mother's lungs into the bloodstream, giving rise to particulates in the placenta that can affect the normal development of the fetus and potentially trigger labour. It may also be possible for carbon particles to actually move across the placenta and into the fetus itself. Poor air quality can lead to an 18% increased likelihood of children being born underweight at term, which can lead to pneumonia in the first years of life and potential infant death. Air pollution is also linked to smaller lung growth rates and reversible or chronic lung disease, such as asthma later in life. And environmental pollution affects brain development and cognitive function, which further compounds a child's chances in life. Well, why are children more at risk? Well, children walk the streets at vehicle exhaust height. They breathe faster, more often, and through their mouths, so air's not filtered by the nose hairs and secretions in the nose. They have more immature immune systems, while the white blood cells or macrophages have less ability to hoover up those particulates compared to adults. Moving on to adults and older people then, the effect of air pollution is systemic. Here you can see that the respiratory system, the endocrine system, particularly giving rise to diabetes, and the brain, the neurological system, is all affected by air pollution. And here is an analysis conducted by Public Health England in 2018, looking to predict the number of illnesses that would be prevented if we reduced exposure to PM 2.5 by 1 microgram per metre cubed up to 2035. And as you can see, a PHE predict a reduction of 50,000 case coronary heart disease problems, over 16,000 strokes, 9,000 cases of asthma, and 4,000 lung cancers. Wow. This year, the British Lung Foundation report The Invisible Threat spells out the impact on the most vulnerable. And they highlighted that vulnerable people become prisoners, effectively, of air pollution, feeling unable, perhaps due to chronic breathing problems, to leave their own homes. And this, of course, has a knock-on effect on their mental health. 85% of people living in areas with illegal levels of nitrogen dioxide, usually close to busy roads, are also the poorest 20% of the population. And isn't there an inequality right there? The people that I work alongside are the most hard-pressed communities who don't often have a car, and their health is damaged by the pollution created by perhaps more affluent drivers driving past their homes. And it isn't just about where those people live, it's also where they get their health care, their social care from. And you can see that a third of care homes, hospitals, schools and GP surgery, this analysis by the BLF, Bush Lung Foundation, are affected by exceeding levels of pollutants because essentially they live in very busy areas close to main roads. My next concern is about the awareness of us health professionals and the actions that we might take. So Philip Barlow, who was the assistant coroner who reopened the investigation into Ella Kissy Deborah's death, the little girl whose cause of death was attributed to air pollution, wrote in his 2021 report about three main concerns. The first about national limits of particulate levels, and secondly, the low level of public awareness of air pollution, but more pertinent for me as a public health nurse, that the adverse effects of air pollution on health are not sufficiently communicated by us professionals to patients and carers. And he called on the Nursing and Midwifery Council and the General Medical Council, our professional regulators, to publish undergraduate and postgraduate education guidelines so that we as nurses and doctors can advise our communities appropriately. But it's not just us health professionals, of course, it's also local NHS and local authority leaders that need to take action. So here, for example, are the actions from the Primary Care Respiratory Society that they would like to see. PCRS, I'm a member of PCRS, and in 2020 they published a white paper and call to action on what they called greener respiratory care. So they are looking at their own patch of the world and thinking about what us, the members, can do about greener healthcare. Essentially, there are various aspects to this. The first one is actually inhalers themselves, and that they should be recycled more often. So if you do take an inhaler on this call, please drop it at the pharmacy. Reducing stockpiling. So at the beginning of the pandemic, we had quite a lot of stockpiling of inhalers. Moving to what's called green inhalers does not refer to colour. Please do not think that, because there is a colour coding. It refers to removing or trying to remove hydrofluorocarbon from inhalers and substituting where clinically possible with things like soft mist inhalers that don't contain them, and moving from those propellant type aerosol inhalers onto dry powder inhalers. Another aspect is about fewer patient and staff journeys, really, and about getting a diagnosis quickly, efficiently, and improving control of breathing conditions so that patients aren't having to travel as many times to see their clinicians. So efficiency, one-stop shops, so that, for example, if you're having tests and you require a change of treatment, you would have that done at a single consultation. You'd have your investigations, the results, the diagnosis and the treatment all in one, rather than having repeated journeys. Digital consultations, which have been slightly controversial because people still want to see their clinicians, but that has the effect of meaning that people don't have to travel. That's had a big effect on young adults, who are the ones who have most difficulty controlling their asthma, myself included when I was 20. So digital consultations have had pros and cons, but certainly reduce travel and efficient buildings. A lot of the impact in terms of environmental damage actually comes from procurement in the NHS rather than the NHS itself. So where the NHS and social care buy their services from, and a lot of that is down to things like equipment and drugs, pharmaceutical companies. And so some of what PCRS are calling for are things like drug formularies, so that when clinicians are prescribing, they have that information on what they call global warming potential, and that they work with the big pharma companies to produce innovations on carbon impact. In summary, what I want to say is breathing clean air is a human right. Poor air quality widens inequalities, and that can lead to what's termed environmental injustice. And for us as clinicians, we need to get our own store set out our stall properly, we need to have proper education, which is built into our curricula rather than discovering it as we go along. And that will help us to enable better local strategies and clinical pathways to improve air quality, that we practice what we preach, and that we as clinicians, as I'm doing here, speak out about matters around air quality and its impact on health. Thank you very much.
Thank you, Heather. Thank you. And we did have a question actually asking if we can get a copy of the slides. And yes, we will. Heather, do you want to stop sharing?
How do I do that? I'm trying to find. Is it the
press the little? Not that one. No, that'll take you out of the call.
All right.
You've done it. Okay. So yes, we will be circulating a copy of the slides, and we will be sharing the recording of the session as well. I don't think there's anything specific in terms of clarification about your presentation, Heather, but I just wanted to say, well, I mean, fascinating statistics, and particularly your slide about the potential reductions in incidences if we could improve air quality, which would have quite a significant cost implication. I mean, 50,000 heart attacks, was it 50,000 cardiovascular events?
Yeah, 50,000.
Yeah.
So the health effects of PM 2.5 exposure costs NHS and social care services at the moment 40 million a year. So any reduction in PM2 will save health and social care significant money, funding.
Yeah, and it seems in a lot of cases that money appears to be a key driver for a lot of initiatives. So perhaps one of the things that we should look at is going into a little bit more detail about the cost benefits of improving air quality, because, you know, hopefully that would give us a bit more oomph behind our arguments here, because I know that Laura has put, you know, we shouldn't be building roads, which I 100% agree with. Apart from anything else, we're in a climate emergency. We should be encouraging people onto public transport, but we don't seem to be investing as much in public transport and as we are in roads. Yet if we were able to demonstrate the benefits in cost terms, in terms of reduction in health incidents, then that might be another good argument for us. I did want to come particularly to this issue of the wood burning stoves, which has come up over and over again in the questions. Would Graham Turnbull mind coming off his or coming off mute? Because Graham, you've raised a couple of issues in the chat, and I think you've talked about the wood burning stove.
Hello?
Are you there, Graham?
Yes, can you hear me?
Yes, we can. Yes, we can. So
Okay.
I'm particularly keen to hear from you, for starters, on the wood burning stoves issue, because I'm wondering whether this is an area that we can target as an action following this call, because I'm keen that what we don't do is just talk about this, but we do take some actions at the end of these sessions. So do you want to just say a few words about your thoughts on the wood burning stoves issue, Graham?
So my name's Graham Turnbull and I live in Sheffield, and I have implemented a network of low-cost PM 2.5 monitors. And I've been doing this over the past 3 years, probably just over 3 years. And what I find is, I live on a reasonably busy road. It's a bus route, and I never see elevated PM2.5 from traffic like what I see from when my neighbors light their wood burners. I mean, it's an order of magnitude or two more than what I see from traffic. And garden fires, bonfires, even worse. I've had measurements in my local area of, up to the limit of the sensor, which is 1,000 micrograms per cubic meter from a bonfire. I've seen, 80 micrograms per cubic meter from a couple houses away from a wood burner. The traffic, we can have lots of traffic, and the PM2.5 is in single digits where it should be. So I'm really focused on PM2.5 because, I understand that if you are living in Europe, your chances of dying prematurely from PM2.5 is 7 or 8 times as high as from NO2. So I'm much more concerned about PM2.5 than I am about NO2. And I'm seeing more PM2.5 coming from solid fuel burning than from transport in my area, at least.
Yeah, I agree. I think PM2.5s are very worrying. Andrew, do you want to just come in there? Is there anything in any of the clean air zones about tackling the wood burners, or is it all about cars? Well, vehicles, as I said, vehicles.
Yeah, I mean, in terms of the clean air zones, that is primarily focused at addressing the issues around nitrogen dioxide. I mean, I think it is worth saying that under the clean air strategy, you talked about cost benefits. The clean air strategy sort of talks about cost benefits of up to over 5 billion per year to the economy of taking the steps that are outlined in the 2019 strategy. And government is taking action to try to start tackling emissions from domestic burning. So, I've mentioned the phasing out of sale and distribution of traditional house coals, wet wood sold in smaller units. So there are actions that are being taken, but I recognise that a number of people on this call will say that that is not far enough, and that government needs to be taking more action. Fundamentally, it's about how do we ensure that people move away from more polluting to less polluting fuels.
Yeah, no, I think that's right. I think maybe there are some initiatives that we can think about, and as we move forward with this initiative, and to look at how we can focus more on that wood burning. I know that other people have different views. Graham, I have had somebody say, can they have the details of your monitors? I don't know if you want to put your information, your contact information in the chat so that people can engage with you on that.
Yeah, I've just done it. Thanks.
Thank you. And there were quite a few comments about the wood burning stove, wood burning stoves with people, and I don't know, because I think, Professor Harrison, it came up in your analysis at North Kensington too, didn't it?
Yes, it did. Concentrations of wood smoke in London, from the limited data we have, seem pretty similar to the rest of the country, which actually means far less people per head of population are burning wood in London, but per unit area of London, you've got a similar number of people probably to those in the countryside. It's worth making the point that wood stoves are quite variable. The problems are mostly with the older ones, but of course these things last for ever and ever, and there's no incentive to people to change them. I think it's from the beginning of next year, all wood stoves sold in the UK will have to meet the requirements of the Eco Design Directive, which will certainly mean that the new ones are a lot cleaner than the old ones. But we're not going to see much improvement unless there's some incentive to change old ones for new ones, or to abandon them entirely.
Yeah. No, I think you're right there. And as Stuart has put in the chat, if if you're unluckily enough to be living in an area that's being gentrified, it's like having to smoke 40 cigarettes a day against your will, because you're getting that smoke all the time. So I think this is an issue that we need to pick up again. The other one that came through a lot on Andrew was the clean air zones. I think you've answered quite a lot of the questions in the chat already, but was there anything that you wanted to pick up to share with people as a follow-on from your session?
So, I think I've tried, and apologies if I've not answered a specific question in the chat. Please do contact me if I haven't. I mean, there's clearly a lot of debate around the effectiveness of CASs, whether they should go further, whether they should be looking at NO2 or PM, whether they should be used for other things, what the long-term future is. I think, we have to recognise that CASs are in some ways driven by the particular legal framework that is in place, and the need to ensure that we are taking action to protect health. These are fundamentally about protecting people's health as well as meeting legal limits. We have tried throughout our work to balance the size and scope of an intervention so that it is delivering the maximum benefit with the smallest impact, because as a number of people have mentioned, there are concerns about the people who are more directly impacted by a CAS may not necessarily be the ones who are able to afford to change over vehicles, which is why there is support available as part of the package in places like Bristol, or will be in Bristol and in Bath, to support people upgrading vehicles. And ultimately, you can debate the degree to which we CASs sort of shift the problem around, but the primary aim is to clean the fleet up as quickly as possible, and also to introduce some options for people to take alternative forms of transport, greater use of public transport, etc. So I think there's clearly a wide range of opinions though.
Yes, I think we need to change the balance of funding from I think and Laura will be able to tell me, 27 billion for roads and something like 4 for other things. So Laura, you'll know the figures there, but I think there's something that we do need to do there to change the balance of the funding made available for various. So public transport doesn't seem to be getting the same emphasis as road building. Now, somebody did raise a question, but unfortunately it's an unknown user, so I can't ask. I live next door to an airport, so can any of the speakers comment on the impact of pollution caused by aviation? Andrew or Roy, would you like to pick up on either of those things, or Heather?
Well, I'll start on that if I may, because we've done a lot of research around Heathrow Airport. The air pollution from the airport seems to be determined much more by the road traffic than by the emissions from the aircraft themselves or the ground handling devices and so on. And the levels of air pollution around Heathrow are sort of intermediate between what you'd see on a busy road in central London and what you'd see somewhere like North Kensington, which is background away from major roads. So it is quite polluted, but it's not as bad as living on a very major highway. But what's interesting about airports is that they have a very distinct signature in the particles that the aircraft emit, which are smaller than the particles from road traffic. And we can actually see those in central London that have been emitted at Heathrow. And some of the work we've been doing has been actually seeing how much individual aircraft are emitting and how different types of aircraft compare. But they do emit these very tiny nanoparticles, 10 or 20 nanometers in diameter. But the fact is, we don't actually know how harmful those are. In terms of the mass of the particles, there's not that much there. So if you just assess them as PM2.5, they're not going to have a big impact. But it may be that because of their very tiny size, they have bigger effects. But the research hasn't yet been done. And the WHO, in their September publication of the new guidelines, did highlight nanoparticles, not explicitly from aircraft, but from all sources, as being something that needed more research, where as a precaution we could try and keep concentrations down, and they did recommend possible limits, but they're not as strong as the guidelines that they put forward, say, for NO2 and PM2.5. So they just are indicative limits, but it is something that we need to keep a close eye on.
Yeah, agree totally. Andrew, anything to add from yourself?
No, I mean, I think the key thing for me is, as Roy said, around the infrastructure that supports the airport is, I think, critical in determining the levels of pollution in that area, more so than the aviation itself, albeit the point around uncertainty around exactly what's emitted by planes. So, you know, Heathrow, for instance, looking at things around zero emission support infrastructure, low emission zones, charges for people to drive to their, you know, greater emphasis on public transport, etc. So I think, you know, when you're looking at aviation, you have to look at the totality of the impact of the airport rather than specifically the sort of impact of the individual planes themselves when we're assessing the air quality impact as opposed to, for instance, the carbon impact of aviation.
No, super. I mean, I have to say, when I'm measuring with a little handheld device outside my house, which is on the flight path from Manchester Airport, when I've had 4 planes going over in an hour, the PM2.5s are much higher than they were before they went over. So they do shoot up. So I don't know whether that's anything wrong with the sensors, but it does seem to happen every time I'm measuring. So but somebody has put in, Kirsten has put in the chat, it's worth discussing the difference between pollution from particles and CO2 emissions. I think people get confused. I think that's a really good point, and I don't know if you'd like to pick up that, Professor Harrison.
Yes, there is a lot of confusion around this, even at the level of senior people in the medical fraternity. I had to write to the Times to correct a letter that a senior medic had written, suggesting incorrectly that the medical fraternity were well informed over the dangers of air pollution, and as Heather has pointed out very clearly, far too many of them are not. And this letter from a senior doctor confused greenhouse gases like carbon dioxide, which at current levels in outdoor air are not harmful to us, but obviously are very harmful in terms of global warming and heating the atmosphere, with locally acting air pollutants, which most of which don't have major effects on climate, although some of them do also have climate effects, like ozone does, for example, but are harmful to human health. So there's a very important distinction there that I think is completely lost on the general public and appears to be lost on a lot of the medical fraternity as well, which I think is most unfortunate. That's
a good point. And I think this is something that we do need to pick up as we go forward, because the whole aim of these sessions is not only to get the public more engaged in the air pollution and air quality debate, but also to clarify issues for them so that they are better informed and can challenge, perhaps, Heather, their health professionals, because I think it's, you know, it's hard to challenge the health professionals if you're not informed yourself, isn't it? So,
yeah, I had a little check on the Nursing Midwifery Council website yesterday, by the way, and found absolutely nothing about air quality and environmental health, apart from the general statements in the code.
Right, that's really, it's shocking, really, isn't it? Shocking. Okay, guys, and I know Rosie and Caroline are keeping an eye on the chat, but is there anything that has been raised that we haven't picked up so far? Caroline and Rosie, is there anything I've missed here?
I think you've done a pretty comprehensive job, to be honest. I mean, there's a lot in there, but it's kind of general topics. So no, I think you've, from my perspective, I think you've covered it. Caroline, is there anything?
No, and Andrew had done a great job of answering the questions as he went along. So thank you for that. That was really helpful.
Well, if anybody's got any specific questions that you want to raise before because we will have to bring the session to a close now, but obviously we'd be very happy to continue this debate after the session today. Andrew, I don't know if you're giving your contact details at all in the chat, or somebody's contact details, so that people can connect with you afterwards, because I know you said that you were happy to be contacted after the session today. But I think sadly we do need to draw it to a close now. So I hope you've enjoyed the debate today, and it's been quite active, hasn't it? And it's been great to have so much input and expertise, not just from the three speakers, but from around our virtual table as well. And as I mentioned earlier, this is the first step in our non-polluting journey. We want to see much more active involvement of citizens in this debate. We're planning our next two events now. The second one has the theme of local measuring and monitoring. So Graham, I'm going to be connecting with you. I was very interested in what you were putting in there. And I know that there's some other great stuff going on. I think Richard Knox Johnson is on the call. And I know there's been some great stuff going on in London as well. So we will be looking at what's going on in local measuring and monitoring and what people are finding. And then the third session will look at how we engage more actively with the public, including reaching those vulnerable people that Heather was mentioning, who might not typically attend the sort of sessions that we're holding here, but might be much more vulnerable than perhaps the rest of us to some of the pollutants in the air. So we'll let you know about those events as the dates are firmed up. If you're not already a subscriber to the Community Planning Alliance newsletter, I'll just put a little plug in for the Community Planning Alliance. For those who don't know us, we are an umbrella group for over 500, almost 550 now, community organisations that are campaigning against inappropriate development in our local areas. We support each other and we also lobby for change. So we'll be looking to connect with citizens and community groups going forward. I think somebody will put the Community Planning Alliance details in the chat so that you can add yourself to our newsletter, put yourself on our map as well. The other thing is that we're also publishing a survey that we'd like you all to respond to. So we'll put the link to that in the chat as well. We're going to be asking about engagement with local authority, and I think some of the people on the call are actually the local authority leads that we'd like to work with. So please do complete the survey, even if you are one of those people in a position of power like that. We'd like to hear from you and have your inputs too. With no further ado, I'm just going to thank you all for joining us today, and a special thanks to our three fabulous speakers. I think you'll agree, very interesting sessions from all of you. Thank you so much for your inputs today. Now, I've got one final thought that I'd like to leave you with, and perhaps you can complete your ideas in your survey responses. But if we were to fast forward 5 years and look back on today's session, what would you like or expect to have been achieved in that time? Perhaps you can say a few words in your survey responses. Anyway, thank you very much. Really appreciate your time. Okay.
Thanks, Marge.
And thank you. Okay. Bye for now, guys.
Bye.
Bye-bye.
Bye.
I think Lucy was asking for a chat after this. Lucy, are you still on the call?
Yeah, I am still here.
Yes, super.
But I don't want to be. I was just thinking I should just go because I might not add anything more. It was a great session. I'm just trying to find. It was a great session. It really was.
Well, I'm so pleased that you enjoyed it, and well.
My father's with me, and he fell while we were in the middle of the session. So we're both a bit shaken. So we had a cup of tea, and we're getting over it. But
you will be able to catch up on the recording afterwards. In fact, with that in mind, I will stop the recording now, and it can start doing its